So I want to share with you a case of early detection of neovascularization in AMD, which is what we're all looking for, right? We want to detect early neovascularization. We want to treat it early to preserve vision and have a better prognosis for our patients that have exudative macular degeneration. And so this is an 87-year-old Hispanic female. She came to me not because she had any concerns with the left eye, but actually because she was wondering whether or not she should continue treatment for the right, which has been through quite the battle. So she had exudative AMD. She's undergone already 12 Lucentis injections in the right eye. The vision in that eye is very poor. She's hand motion, and she's coming to me just wanting a second opinion to say, should I continue injections in the right eye or not? Her left eye acuity is fairly decent, so about 20/40 best corrected visual acuity in the left eye there coming in. If we look at her right eye, again, we can tell this has really been through a battle and probably lost, unfortunately. So despite, 12 Lucentis injections, she's got massive exudation, massive fluid, subretinal scarring, consistent with this hand motion vision. So she's essentially a monocular patient at this point in time. Didn't recommend really continuing anything there for the right eye. But if we look at the left eye, my concern now moving into the exam is I need to make sure that this left eye is non-exudative and doesn't require treatment. So the acuity is pretty good, 20/40, I'm feeling good about that. Just looking at the fundus, I didn't see any obvious signs of exudation in terms of subretinal hemorrhage. I mean, she has a little dot blot hemorrhage there from diabetes, but there's no substantial subretinal, sub-RPE hemorrhage, no exudate that would suggest to me that there's a choroidal neovascular membrane there. I wasn't able to clinically appreciate any subretinal or intraretinal fluid that would suggest neovascularization. Looking now at our conventional macular cube scan of structural data within the macula of the left eye, we can start to appreciate that there are some subtle signs of exudation. Looks like there's some intraretinal fluid. There's a small pigment epithelial detachment underlying that area of fluid, which is suggestive of perhaps a choroidal neovascular membrane. With OCT angiography, we're able to visualize not just the secondary effects of the membrane, like this fluid that we were able to see here, but the membrane itself. And so here we're looking again from anterior to posterior at the superficial, deep, avascular, and then choriocapillaris infos preset displays. In the superficial and deep infos displays, we can see there's some abnormal vasculature that appear to be extending into the temporal portion of the fovea there. And I've marked for you where the center of the fovea is with the little yellow dot, just so you can try to orient yourself. And so that abnormal retinal vasculature is extending down and connecting to a very small choroidal neovascular membrane that's located underneath the RPE that we can visualize on the avascular and the choriocapillaris preset infos displays. This is a 3mm scan window, so again, this is a really small choroidal neovascular membrane. Another way that I like to view OCT angiography data is by simply hitting the play button on the machine, and it will give you a video where it's a preset segmentation slab that just pulls from anterior to posterior. So it gives you a really nice just overview of where the depth of lesions are located. And so here as we go from anterior to posterior, we can see that abnormal retinal vasculature extending down, connecting, boom, right there to that choroidal neovascular membrane. So this is a nice way to visualize this 3D information as well. And so what's the clinical take home here? OCT angiography is going to allow you to detect the earliest choroidal neovascular membranes present in patients with AMD. If we're able to earlier diagnose choroidal neovascularization, we can treat it early, and then we can preserve vision for our patients. We have a better outcome visual prognosis. Generally, you should look for choroidal neovascularization in the avascular, choriocapillaris, and choroidal preset infos displays.